Guys, today we will learn about incretins. What are incretins and what is incretin effect? There are two types of incretins in our body mainly. The first one is the GIP and the second one is GLP-1. Both have their effect called the incretin effect. What is the incretin effect? Incretin effect is oral glucose leads to greater stimulation of insulin with respect to the IV glucose. So this oral glucose will lead to increase GIP and GLP, which further causes beta cells to release more insulin. This is a very short how they act, but let us see how they are secreted in our body. The GIP is mainly secreted by the K cells in the duodenum and upper jejunum, and the GLP-1 are mainly secreted by the L cells in the small intestine as well as large intestine. They are also abundant in colon as well as in rectum. So how they causes insulin to get secreted in our body whenever we take anything orally. Whenever we take something orally, that is the nutrient, whenever we take any nutrient in the form of carbohydrates or triglycerides or few amino acids, they cause increase in GLP-1 and GIP. Both GLP-1 and GIP are increased. They have their own receptors on the beta cells. There are receptors on the beta cells which causes increased in cyclic AMP, and then which activates protein kinase A. This protein kinase A will secrete insulin. So, but there is one more important thing which is necessary, that is hyperglycemia. Hyperglycemia, that is more glucose is necessary. This causes closing of potassium channels, and this calcium influx. This hyperglycemia causing closing of potassium channels and calcium influx will causes insulin. So this hyperglycemia is necessary for the activation of GLP and GIP-1. Until unless there is hyperglycemia, no release of GLP and GIP in the intestines, and there is no release of insulin. So in type 2 diabetes, what happens in type 2 diabetes? In DM type 2, there is progressive loss of GLP-1 secretion. So there is decreased insulin secretion even when you are taking your nutrients orally. So there is hyperglycemia, right? So when there is hyperglycemia, you have higher blood sugar levels. So what is the therapeutic effect? Like whenever you are using GIP or GLP-1, like it's producing in the body, how therapeutically it is important, we need to understand that. Therapeutically it is important because they helps in reducing our blood sugar levels. So therapeutic effects, let us see the therapeutic effects. The therapeutic effects of GIP, we don't have any drug with respect to GIP, but we have drug with respect to GLP-1 agonist, including liraglutide and dulaglutide. But why GIP is not used? Because it is having very negligible effects on insulin secretion, and at low blood sugar levels it also causes increase in glucagon activity, which may further causes increased blood sugar levels or hyperglycemia. So that's why it is not used. But GLP-1, it has many effects on the body. GLP-1, it delays gastric emptying. Okay, it decreases or have appetite. It acts centrally at the satiety center. Okay, so there is loss of, you can not say loss of, but there is decreased appetite. So all these will help in controlling our blood sugar levels. So the GLP-1 has effect on fasting as well as postprandial blood sugar levels. There are Now let us see pharmacology of this. What are the examples and what are the things which is needed to see in this? The GLP-1 have short acting and long acting. The short acting are exenatide, and the long acting are liraglutide or dulaglutide, which covers both fasting as well as postprandial blood sugar levels. So they have the long acting, therefore can be used with low doses. What are the side effects of the drugs? It is also very important since it decreases gastric emptying. The side effects, since it decreases gastric emptying, may have nausea, vomiting. Sometimes it may also have diarrhea, and it is contraindicated in few conditions, including medullary carcinoma of thyroid, Men's syndrome, and any pancreatic disease. In all these conditions, it is contraindicated, and the side effects are mainly nausea, vomiting, and diarrhea, which can be overcome by slightly titrating or slowly increasing the dose. Slowly increasing the dose every week, the side effects can be managed. So this is mainly about incretins. I think I have completed most of the things in it. Thank you. Thanks a lot.